Hello, this is Mrs. C. This is lecture chapter 22, assisting with bowel elimination for class PC 103. Hope everybody is doing okay. If you have any questions about the assignments, you can always inbox me. I'm always available. All right, so chapter 22. Learning objectives for this chapter: promoting bowel elimination, administering an enema, discuss the factors that can interfere with bowel elimination, describe the various types of enemas used to promote bowel elimination, discuss the care necessary to maintain an ostomy, and identify the potential complications of an ostomy. There are some key terms that I would like for you to go over on your own time. You will see those again. All right, bowel elimination. You may hear people use the word defecation. It's a human need. We all have to do it. It's essential for bodily function. Sometimes in our older patients, where they get dehydrated, it gets complicated for them to pass stool. And there are different characteristics of stools. And when you are documenting when a patient has defecated, you will use that chart to put the characteristics in your notes as to what the stool looked like. Yes, you have to look at what it looks like. All right, so a normal bowel elimination depends on several factors: a balanced diet, making sure you have you're intaking the appropriate amount of fiber, daily fluid intake, which daily fluid intake is 2,000 to 3,000 milliliters. Activity, you got to move around to make sure that we are promoting, stuff moving around. Get it? Moving around. Every patient should have a bowel movement at least every 1 to 3 days. So if it's been more than 3 days, the doc may order an enema for the patient, where that will be something you would have to administer. Or the doc may order some type of stool softener or something to promote this patient to go to the bathroom. All righty. To promote, to encourage the patient to have the urge to defecate, you can have the patient sit on the commode or the bedside stool. If he or she is in the bed, you want to put the bed all the way up in the high father's position. Sitting up promotes defecation. Sometimes if they're sitting on the stool, you want to sit them up and put like a telephone book. I don't know. We don't have telephone books. A small stool or something to lift their feet up, because like the lifting of the feet and them sitting up will promote the defecation as well. And some people just have a hard time defecating. It's just not something that they do normally. Some people need to have assistance for defecation. You want to make sure that when you do put the patient on the commode, or you take them to the bathroom, or they on the bedpan, that you give them some privacy. Everybody can't use it with you sitting there staring at them. So that's another thing we want to remember. Let's see. If you have a patient that has hemorrhoids, because sometimes we as patients, when they can't go to the bathroom, or they're having a hard time going to the bathroom and they're pushing, they will develop hemorrhoids, because now they're pushing, they're trying to push out the stool, and the stool will push the hemorrhoids out as well. So you may get a patient that develops hemorrhoids. They can come from constipation. A lot of pregnant moms get hemorrhoids. You can get hemorrhoids from heavy lifting. But for the most times, they come from pushing, the strain of constipation. So the treatment of hemorrhoids, they have hemorrhoid creams. Sometimes they are so big and so swollen that they have to be removed. However, most times if you treat it with some hemorrhoid cream and push them back in, that's kind of then they they'll go down. Let me backtrack a little bit. Let me tell you what a hemorrhoid is. A hemorrhoid is swollen tissue around the anus. All right. All right. Flatus, gas. That's all it is. You have air in the intestinal tract. A lot of times it happens when people eat carbonated drinks, or they eat cabbage or beans. Sometimes when you eat too fast. It can also be caused by when you have like some type of abdominal surgery or surgery period. Some narcotic medications can cause flatus as well. A lot of times it may cause the stomach to be distended, so the patient will experience a lot of cramping. Sometimes they'll say their back is hurting, their side is hurting. So gas can be scary because sometimes people can have gas and feel like they're having a heart attack. So we have to make sure that we are helping our patients eliminate the gas, which mainly you got to get up and get moving. All right, administer an enema. This is also a checkoff that we will be working on ground. We will set up a date and time for everyone to come in. So to administer an enema, there is a solution that goes into the colon via the anus, and the primary reason for the enema is to promote defecation. Sometimes people get enemas too before surgery. A fecal impaction is a collection of feces in the rectum in the form of a mass that becomes so large or hard that the patient is unable to pass it. So sometimes you have to administer a medicated enema to help relieve that fecal impaction for that patient as well. No matter what type of enema you use, you definitely have to use caution, which we will definitely go over all of the enema do's and don'ts before we actually do the skill when we come on ground. All right. Ostomies. Ostomies are an artificial opening. The site of the opening is called a stoma. Ostomies can be created because of trauma of the intestines or some type of severe inflammation or disease. Ostomy bags and stomas and ostomies have to have specific care. They have to be clean. The ostomy bags have to be emptied and changed. And you have to be really careful with these ostomies and the stomas because, they can get an infection. Even though you're thinking like, is stool coming out of here, they still can get an infection. So it definitely has to be clean and treated properly. They can be temporary or permanent, depending on the reason that the patient has the ostomy. Depending on where the ostomy is on the patient will determine where the damage is, if that makes sense. The material that's coming out of the stomach contains many enzymes that increase the acidity of the material. Therefore, stool in the colon tends to be more acidic and irritating to the skin. So as I was talking about, making sure that it's clean and that it's cared for properly, because you have this opening that is helping this patient defecate to get stool out, and you want to make sure that the the stuff that's laying on the skin, that the skin is cleansed, that's getting some air, that is completely dry before you put the bandage and everything on. And we will definitely go through the stoma and the ostomy bag process from start to finish. So when we do come on grounds, we will plan to be here for a couple hours, because we're gonna have to go back and kind of go over some things. All right. There's a procedure in the chapter that goes over how to care for the ostomy, or the colostomy. All right. So, give me 1 second. So when they have this appliance on, an ill-fitting appliance can cause a pressure sore and can lead to gangrene. I mean, because of stool is, it has a lot of bacteria, good and bad. However, once the bad bacteria is on the outside of our bodies, and it may get to the inside of our bodies, that could potentially cause a problem. All right. Illness and injury for prevention. Avoid hot water and harsh soaps when washing the skin around the ostomy. Perform ostomy care at any time the bag is leaking to prevent skin breakdown surrounding the ostomy site. The cost of ostomy supplies and reimbursement are often an important concern for older patients with limited incomes. Refer to community service to get supplies. Some patients acknowledge the stoma with minimal emotion. Some never completely adjust to it. In most cases, patients are able to wear their normal clothes. Snug fitting clothes do interfere with the function of it. The skill for applying a pouch to a fresh stoma requires the critical thinking and knowledge of a nurse. Some facilities permit delegation of the task of pouching in an established ostomy to the PCT. Let me tell you something. You will be delegated that task. And sometimes you're going to be the one to say, hey, this bag need to be changed. Don't wait for the nurse. Alrighty. And we will definitely go over the procedure for that. I think I'm going to post the procedures. I'll definitely post the procedures on Canvas for the ostomy, the bedpan. I'll post some videos and the actual procedures from the book. All right. Sum it up. The PCT uses many skills to assist the nurse in the care of a patient. Bowel elimination is one area where the PCT's knowledge and expertise can be used. By being aware of patient's individual needs and adapting care to meet those needs, the nurse can provide safe, effective nursing care to the patient, so that the patient can reach his or her highest level of functioning. Because at the end of the day, we always want our patients to get better and to get back to baseline or higher than baseline. Proper administration of an enema consists of slow installation of the correct volume of warm solution. Emotional support to the patient with the ostomy is important to foster eventual acceptance of the change in the body image. I always try to tell people, mask your emotions. Right now we are living in a time where we wear masks, so you can kind of hide it, because ostomy smell pretty bad. So when you go to change one, don't be like, and even if you are, try to hide it. Trust me, I've done it. That's why I can speak to it, because I've done it. And it's embarrassing, especially if the patient kind of catch on that you having a problem. All right. Even when the ostomy pouch is adhering well, it is best to change it at least every 3 to 5 days, or according to pouch recommendations. To allow for observation of the stoma, the skin, or to allow for observation of the stoma and the skin around the stoma. Skin impairment is is possible after repeated exposure to liquid stool. If you ever are changing the stoma and you know this patient is having skin irritation, you see the skin is broke down, make sure that you document and you report it to someone. You document it. I'm sorry. Make sure you report it to someone. You document what you saw and document that you reported it, because that can be a huge problem for them. All right. And that is our lecture for chapter 22. I will see you guys soon. Again, I'm going to post those procedures for you and some other little charts and stuff like that. So have a great rest of the day.